Hi, I am Dr. Prathipa, MSD and BOG. This is my topic regarding first and second trimester aneuploidy screening. So, nama aneuploidy screening most common aneuploidies like Down syndrome, Edwards syndrome, PAPP-A syndrome இதெல்லாமே தான் நம்ம இதில் screen பண்ண போகிறோம். So, first trimester screening usually done between 11 weeks to 13 weeks plus 6 days. அப்போது நம்ம first trimester screening ஓட componentsல first NT measurement, neural tube Nuchal translucency measurement. Usually இது வந்து நம்ம USG மெத்தடில் பண்ணுவோம். 11 weeks to 13 weeks plus 6 days. Normal value it should be less than 3 mm. If it is more than 3.5 mm, we have to do this double marker test. So not only in elevated NT, if mother is having previous aneuploidy baby, mother is obese or any maternal diabetes mellitus or maternal high maternal age, இது மாதிரி கண்டிஷன்ஸ்லாம் கண்டிப்பாக we have to do double marker. So double marker includes pregnancy associated plasma protein A and free β-hCG. So நம்ம வந்து காமனாக இருக்கிற syndromes எடுத்துப்போம். First Down syndrome, trisomy 21, then Edwards syndrome, this is trisomy 18 and PAPP-A syndrome, trisomy 13. இப்போ PAPP-A will be, so நம்ம வந்து first காமனாக எது இருக்கு பார்த்துப்போம். So in Down syndrome, free β-hCG will be elevated. All others are decreased in first trimester. This is alone will be elevated. மற்றபடி everything will be decreased in Edward, in PAPP-A and Down syndrome PAPP-A will be decreased. So இதை மட்டும் ஞாபகம் வச்சா போதும். So next second trimester. Second trimester screening வந்து usually done after 15 weeks. Ideally நம்ம 18 to 20 weeks எடுத்துக்கலாம். So second trimester screeningல you have alpha fetoprotein, β-hCG, unconjugated estriol and inhibin A. So in Down syndrome, Edwards syndrome and PAPP-A syndrome. Down syndrome trisomy 21, Edward 18, PAPP-A 13. So Down syndrome la நம்ம apply படிச்ச மாதிரி தான் free β-hCG will be elevated and also inhibin A also elevated in second trimester. In PAPP-A la inhibin A alone elevated. So இது மட்டும் ஞாபகம் வச்சா போதும். மற்ற எல்லாமே alpha fetoprotein will be decreased, this will also decreased, everything will be decreased in Edward, in PAPP-A everything will be decreased except inhibin A. Inhibin A increased in PAPP-A. Okay, next what is NIPT? NIPT also one of the screening test. So it's not a diagnostic test. NIPT is one of the screening test, usually done more than 10 weeks. In NIPT, in NIPT usually நம்ம என்ன பண்ணுவோம்னா we are going to extract circulating cell-free DNA from maternal circulation. So maternal circulation வந்து we are going to extract fetal cell-free DNA. So this DNA we will send for analysis, karyotyping and other analysis, and we will rule out all fetal chromosomal abnormalities. So NIPT is a screening test. It is not a diagnostic test. If the result is positive, you must be confirmed with CVS or amniocentesis. Among this screening test, NIPT gives more than 99% successful positive predictive value. Next, a screening test are only to estimate the risk. If a screening test comes positive, so you have to do a diagnostic testing. So next we will see what are the diagnostic testing available. So diagnostic test la first வந்துட்டு என்ன இருக்கு அப்படினா chorionic villi sampling. Usually it is done between 11 weeks to 13 weeks plus 6 days. Next, amniocentesis. Amniocentesis usually done after 15 weeks to 20 weeks. Next, cardocentesis. Usually cardocentesis வந்து after 18 weeks. நம்ம வந்து cardocentesis வந்து associated with more fetal loss. அதனால we are not routinely practicing it. First, chorionic villi sampling. It is done between 11 weeks to 13 weeks plus 6 days directly. First trimester la நம்ம doing chorionic villi. So the diagnosis will be earlier. So இந்த diagramல பார்த்தனா we are under ultrasound guidance la நம்ம என்ன பண்றோம்னா ஒரு thin needle we are inserting in the chorionic villi placenta and taking sample from chorionic villi. So usually if it is done before 10 weeks, it is associated with limb reduction defect and oromandibular abnormalities, and it also done in earlier week, so the diagnosis also earlier. The fetal loss is 0.2%. It is comparatively more than amniocentesis. Next, amniocentesis usually done between 15 to 20 weeks. Same USG guidance la we are inserting the thin needle into the amniotic cavity and we are extracting the amniotic fluid. Amniotic fluid contains cells, proteins and alpha fetoprotein and other minor elements. So nama in the cells we are going to send it for karyotyping for chromosomal study, and it is and this alpha fetoprotein helps in diagnosing open neural tube defects. So this is one of the MCQ frequently asked. So in chorionic villi we will not get this alpha fetoprotein values, but in amniocentesis we will get AFP results. So we can, if AFP is increased, we can diagnose open neural tube defects from amniocentesis. So it's a gold standard procedure for fetal chromosomal abnormalities after the first trimester. The diagnostic accuracy is more than 90% and fetal loss is 0.1%. It is lesser than the chorionic villi sampling. Next, cardiocentesis usually done after 18 weeks. That is, we are taking sample directly from the umbilical cord. So நம்ம umbilical cord oda blood la irundhu we are taking fetal cells for analysis. That is called cardiocentesis. The fetal loss is more than 2%, so we are not doing this. Next, so questions பார்ப்போம். ஒரு 12 weeks indirectly it's a first trimester and we are doing aneuploidy screening. Highest detection rate, usually a single test alone we will not accept as a highest detection rate. So we have to go to combination test, NT, PAPP-A and free β-hCG. இது மூணுமே called combination test. So combination test வந்து always having highest detection rate more than 95%. Next, a 16 weeks pregnant woman has positive screening test for Down syndrome. So it is second trimester, 16 weeks, and we have done screening test. It was positive for Down syndrome. So now what is the next best step? So screening positive அப்படினா next step வந்து directly we have to go to diagnosis. இதுல diagnosis வந்து amniocentesis தான். So amniocentesis for fetal karyotyping is a diagnostic test. Next, so highest limb reduction defect if it is done before 10 weeks அப்படினா இது வந்து serious தான். நம்ம படிச்சோம் chorionic villi sampling should be done after 11 weeks to 13 weeks plus 6 days. If it is done before 10 weeks, it is associated with limb reduction defects. Next, most accurate non-invasive screening for trisomy 21, it is indirectly Down syndrome. They are asking non-invasive screening test. Usually idhula paakumbodhu amniocentesis we will think it is a most accurate test, but it is a invasive. So double, quadruple and NIPT இது மூணுமே non-invasive. இதுல most accurate is NIPT more than 99%. The answer is NIPT. Next, first trimester shows an NT of 4.2 mm. It is elevated. So next best. So நம்ம usually என்ன பண்ணுவோம், NIP if NT is elevated, next we will go to double marker test, or இதில் ஆப்ஷனில் double marker இல்லை, ஆப்ஷனில் repeat NT scan பண்ண சொல்லியிருக்காங்க. This is not the answer. Triple marker we are not routinely doing it. No, we have to evaluate because NT is high. So next we have to go for diagnostic test. ஒன்று CVS பண்ணலாம், இல்லை அப்படின்னா இதோட accuracy improve பண்ண we can do for NIPT counseling. Next, open neural tube defects are the best detected by whether it is PAPP-A or NT or maternal serum AFP or free β-hCG. So open neural tube defect la we will have elevated alpha fetoprotein. இது நம்ம already படிச்சிருக்கோம், elevated alpha fetoprotein. So maternal serum alpha fetoprotein is the answer. Thank you.